sort of comments from our friend in Ireland around feeling that patient experience still isn't being listened to, through to the whole issues of health literacy, both digital and functional as well, through to people's perception of tech and everything else. So it's quite a heady combination of things. So David, over to you to begin your thoughts.
Simply to echo what you said, Jim. I mean, one of the reasons why you, I, and other members of the group that planned this meeting was to try and kind of demonstrate the huge range that patient empowerment and community empowerment represent. And I think the speakers have done a fantastic job in encouraging us. It's this balance, isn't it? Things are dire in the sense that, as Alf said, the health system's in danger. People are very fed up and frustrated because it seems like nothing changes and people don't listen. Yet at the same time, people are doing fantastic work, you know, in trying to move things forward. I thought it's very interesting that Cecilia was saying, is patient empowerment one of the levers for health transformation? I certainly believe it is. But the main point I wanted to make, though, was what we haven't talked about quite so much, but it's been implicit throughout all of this, is about how self-management is supported, because it's a vital part of changing the whole balance of things in health, sickness care, certainly, but of course self-management then extends, doesn't it? We've talked initially about self-managing in chronic care because it was seen by the policymakers as a way of saving money, but actually, if you look at it seriously, I mean, people with lived experience know damn well they're better at self-management with a bit of help, appropriate help, than if they're simply following the instructions of healthcare people who see them once every so often. But actually it extends the whole life cycle, doesn't it? It's about staying well as much about self-management, isn't it? It does seem very interesting that we've kind of taken it for granted, but certainly, for example, digital is an incredibly useful enabler for self-management of all kinds, really, isn't it? And it's maybe a way forward to help us get out of this 19th century dominant model of the hospital being the center of everything, which is a nightmare, really. In my view, having been a doctor, a retired doctor, but having been through the whole system. When I started as a medical student 60 years ago, it was kind of, one didn't even question the assumption. Now, thank God, we are questioning it.
If I may add to your comment, David, I really agree with you. Of course, digital tools can really help to this self-care management. But I wanted to add something that I didn't mention during my presentation, but I think is really relevant here. You mentioned me saying that empowerment could be one of the keys. I'm not going to say the only one of this transformation. But some other thing that is happening is that we make a lot of effort in empowering patients, empowering citizens, developing a lot of tools for this. But we, Jim mentioned it before, but we have done less effort in empowering healthcare professionals. And I think this is another key aspect that we need to consider, because part of the problem, if you want to look at it like that, is that you have to change, as I mentioned before, the way you do things. And if you continue doing these things in a way that the doctor is telling the people what they have to do and they just do it or not, but this is it, then we are going to continue doing the things in the same way, no matter what tools they have, what empowerment tools they have, or something like that. So a very big effort should be to I call it empowering healthcare professionals. Maybe it's not the right word, but at least to make them a participant of all these things and to really commit to this change. Otherwise, yeah, a lot of things have to happen in order to actually have this transformation.
Thank you for those. And a comment which has come up in the chat around from Gertrude, whose sort of expression she's come across recently is you need to look after our healthcare system because it's a system which is getting sick as well. So I'll paraphrase there slightly, but I think that's quite an interesting point. You know, when we talk about, you know, overload, burnout, all of this, I mean, all of these in a way are symptoms, aren't they, of a system which isn't working, which isn't functioning. You know, when different components of it, i.e. The people in it, are reporting sort of poor mental health and stress and overworking and everything else, you know, so it does indicate that things are certainly not right, and there's a need to change. Elliot.
Oh yeah, it was just 2 points, if that's okay. Firstly, the first one was about the other part that we're talking about technology with empowerment is that people don't consider it. So when you go to the doctors, you have 5 minutes to talk about what your actual problem is. So you do what's the top one. My hand's hurting, therefore that's what I'm going to go with. What you can't do is what the doctor doesn't know is you might have other areas that are actually hurting or other things that are bothering you, and they're not picked up in that session. The way you can look at digital on that is that you can be to lose weight. Well, have you looked at this application? Have you looked at this? And those things can be used to then help you outside of those sessions. So we use it in like physio. If you're going to see the physiotherapist to repair your body, you've not been able to exercise for so long, you could have an application like My Fitness app, for example, that helps you track calories, look at your exercise in there, do all these sort of workout things. And then every 3 months you're seeing your physio for that particular area, but you're also improving all your other areas by using the technology and things like that. The other one as well is when older people are trying to access technology and they don't want to use it. You'd use an example like if you go into the supermarket, they want to use the person because they want to speak to somebody. That's their social sort of thing. So we use the example of you've got 5 minutes to get to an appointment. If you go in the queue, you're going to be 10 minutes late. If you use the electrical checkout, you're going to be on time. Which one's most important to you? And they go, well, I want to be on time for the appointment. So therefore you teach them the technology. It's what's best for them at that point. If they have got lots of time, absolutely sit in the queue. If you haven't used that. So it's the enabler side of person, how you can actually help with technology. So that was the first bit. On the other bit, and I've seen it a bit, I'm not sure what it's like outside of the UK, but I always look at the NHS. When I started the NHS, I thought it was the NHS as a whole and everything. And what it seems to be is it may as well be a different world made up of all these different companies. And all the different companies buy in all their different things. So you could be talking about a piece of technology from the Alliance there that says this is what it does. And you'll have West Lancs using somebody else. You'll have London using somebody else. You'll have Newcastle using somebody else. So then asking everybody's system to then integrate into the same system. So if you went away to somewhere else, that's not going to work because it's not the same system. So you need something like your marketplace sort of thing where you've got your central one, which would be your main area that it all feeds in, but they have all their own thing and it all feeds out. But that's a big job, and getting people to agree for that in their different places and everything is going to be a completely different conversation. And I think that's what's needed first before we can start saying about what we're going to buy in. Thank you.
Okay. Thanks, Elliot. Marquita. Hi.
Yeah, I was just going to add something really, really positive about digital first. And that's, I think that with digital technology, we open up the door for diversity a bit more. I think sometimes, particularly my experience sort of working in healthcare and then coming into the corporate space, is that there is a lot of sameness. And, you know, when you walk through a door and you don't see people that represent you, I think that can be quite a barrier to access support. And I think with digital technology, particularly, for example, in mental health, particularly men that traditionally are overrepresented in kind of acute inpatient, particularly Black men, and then, you know, underrepresented in sort of primary care, I think technology can really open up the doors to groups of people who wouldn't traditionally use kind of, I guess, the medicalized model or traditional services. So I think there's great opportunity with digital to provide difference. I guess my other comment, and on the flip side of that, is, you know, when we're talking about sort of inequalities and meeting, you know, people where they are, and I think a lady talked about it a little bit earlier about, you know, when she expresses kind of what they would like as a person with lived experience or someone from that patient group, that, you know, there's this kind of whole process of being done to. And actually, if we're really serious about sort of devolving healthcare and making it more equitable, then we have to accept that maybe we're not the best people to do that. And I think that narrative shift is really tough in a system that, you know, has dominated and done things in a certain way for 20, 30, 40 years. So, you know, there's a lot of socialization and culture system change that needs to happen so we can really, you know, deliver what patients want and what they're asking for.
Really good points, isn't it? I think this comes out time and time again in sort of the whole approach to sort of self-management of things and peer support. You want to see someone like you, don't you? If you walk into a peer support group, for example, you want to see yourself reflected in the group, and likewise the same as sort of services. You want to see yourself reflected in the people there. And maybe digital is a way of, you know, a way of achieving some of that. Cara, you've got your hand up.
Yeah, coming back to the systems, making it a universal system, because at the moment in Ireland, the health system, the mental health system, is on a different suite than what the general system is on. Okay, so therefore then your mental health records cannot be switched over to the general for the integrated care. Now, integrated care is one of the big issues as well in Ireland. Again, as I say, mental health seems to be pushed. We're kind of like the umbrella that is there, and it's not being integrated into the mainstream stuff. So if the systems are different, as was said by Keith, we're not going to get anywhere with this, because it is a business. Everybody wants to go out there and get their software put in there. But I find it very hard for someone to agree, or the groups that are on the digital stuff to agree to make a universal one, because otherwise it is not going to work. I mean, I have seen with our thing with the digital care is you'll have the radiology not releasing their files to the general, and because they're their files. So if you have interdepartmental mental problems, you're not going to get your identifier out there. So, I mean, it goes back to corporate. How committed are corporate to getting the identifier in there? How committed are they in getting everybody on board to have a universal one? Because if they're not going to include mental health within that system, we're going to be way behind, way behind.
Yeah, no, absolutely. I think there's also a nervousness as well amongst commissioners around whole system technology based on some of the money which has been spent in the past as well, which is also doesn't help around some of the legacy projects which have not turned out quite as well as everyone hoped. Christine.
But if they got integrated care done first before they do the identifier, we might get somewhere with it.
That's true. That's true.
Hi again, everyone. I was just thinking, based on everything that I've heard this morning, one thing that really sticks out to my mind is that we keep hearing about the system, the challenges with the system. And one way to get around that could be, it's just an opinion of mine, is that if we focus on corporate as potentially the best approach of circumventing the institutional model, then it's almost like privatizing health, right? When corporate takes the lead role, then they're focused on their ROI and their ROE, and that can manifest in changing their bottom lines, their budget line items in terms of insurance. So it may be a good way to partner with corporate entities and to literally work through some of the ideas that we have been sharing this morning.
That's an interesting approach, and it also brings up the huge differences between healthcare systems. Of course, with the NHS, the words corporate, private, money, bottom lines are absolutely sort of sends politicians running in terror at any hint of a privatization or sell-off of our wonderful institution. Whereas, of course, if we look at other countries with a mixed economy of health insurance and state, I'm not quite sure anyone would fully advocate the total market approach of parts of the US, but certainly it does give food for thought of how innovation can be changed by other motivations as well, such as sort of the bottom line and this sort of thing. So yeah, okay, yeah. Lars.
Yeah, I think it's interesting about this corporate thinking, as when I look into the Netherlands and Germany, you have insurance companies in Israel as well, driving or paying for a lot of the services. In Scandinavia, we do not have that to a huge extent. And actually in Denmark, we have one personal identifier, and all healthcare data from the secondary sector, from hospitals and affiliated services, are accessible for municipality professionals and carers. It's accessible for patients there, if mandated, their relatives, and also general practitioners. The main problem is actually that the general practitioners are working as corporate persons. They have their own businesses that is subsidiary from the regions or the government, but in principle they are private and they do not want to share their data. So if we learn from Denmark and the remaining part of Scandinavia, it actually speaks against the corporate thinking. And then when we look into the system problems, one of my good friends, he has a company called Epital Health, where he is educating and certifying health students, from the Faculty of Health within a very short certification period. And actually they are servicing people with COPD and heart condition in a more efficient and effective way than the average experience is in the public health systems. So maybe we should rethink which kind of professions to use in which situations, and how we can assist people like Wagner's thinking chronic illness model by having intelligent systems to support the way to handle patients, and then reconsider the role of the professions.
Thank you, Lars. I mean, is it right, David?
Yeah, just to respond to Lars, I mean, this is, we're often talking just in this room about how we break the current system to make it more functional, more effective, and to really meet the needs of the people who matter, society, the citizens. And what Lars was talking about, and in a sense, Christine also was hinting at, this is about disruption, isn't it? People talk about disruptive technologies, and this famous book by the Harvard economist Christensen about disruptive innovation. it's really about challenging the system. I was in a lecture in, believe it or not, by one time I went to Brazil with, there was a huge conference about improving education of students in Brazil. One of the examples they gave was doctors didn't want to go and work in primary care in the country because it didn't further their careers. And so when they had the option to do it, they couldn't fill the places. So what do? They got 200 doctors from Cuba who were quite willing to go and do the work. The doctors in Brazil were furious because they said, look, these guys, we don't know who they are. They've only had less training than us. They're not accredited by our blah, blah, blah. Of course, the fact is it worked, you know, and it really challenged the system. You know, I think we need those kinds of initiatives, if we could possibly get them, to really shake things up. Because one of the things that is messing up the system currently is the unwillingness of the professions to consider reprofiling and different kinds of skill sets, which could involve less training, but be just as effective. The exact point that Lars was making. You know, but it's really hard. The professions are the worst offenders in terms of resistance to change, in my view. And it's you can't blame them. It's just the fact that you've got to deal with the problem.
Okay, thanks, David. Good. So I think all of the presentations today have pointed to the fact that there's a huge amount of innovation out there. Is point to the fact there's a real willingness to innovate and implement approaches. Is, you know, it's really recognized the fact that people are different. There's no one size fits all solution, yet there are some things which are universal as well, particularly from a digital point of view, and help just joining up. You know, the simple thing, you only have to have one conversation. You don't have to repeat your story to every single person you meet within healthcare systems, because there's absolutely no transfer of your record between, say, the mental health care sector and the acute care sector and the primary care sector. So there's some quite systemic issues which affect all of this, and also sort of collective thinking as well. I think, you know, we talk about all of this, yet, you know, I've never yet met a clinician who doesn't think that putting the patient at the center of their care and their views is not important, oddly enough. Yet so often the behaviors which manifest are actually different. And there's a study, actually this was in the Netherlands, which asked consultants around their views on shared decision making, and to the extent that they included patients in decisions, and they all sort of pretty much rated themselves pretty highly and thought they did. However, when their consultations were actually observed and recorded and the patients were asked, actually the reality of the situation was very different to their perceived to their perception of what they were doing. I think this is quite a big issue, that actually people's perception and systems' perception of what's working is actually very different to the actual experience of the people using those systems. And I think this is quite a tricky one to overcome. I would like to take an opportunity just to thank all of our speakers and all of the contributions to today. We've covered an awful lot of ground. And a huge thank you to our participants who sort of stuck with us, and I'm sure sort of dropped in and out of various pieces. And that's one of the great enablers of digital, in a way, around to have these events and allow people to get on with their work, and also sort of dip in and out of various bits and pieces as well, which you know, so there are pros and cons, and I think that's mirrored right across the way. The presentations will be made available, a recording will be made available, so if there's bits you've missed and you want to catch up and information you want to delve into and follow up various references and everything, please do so. And once the recordings and things are ready, we'll let you know through the Eventbrite system where we can put that out. And really, unless on that note, I would just say a huge thank you. And I hope people have gone away feeling optimistic rather than pessimistic. You know, and as I say, whilst recognizing there's a long way to go, sometimes for those of us who've been working in this field for a long time, it feels that we haven't moved ahead, and it just feels you're having the same conversations again. And Debbie made this point earlier, you know, remembering these conversations, but using different words. But I think this stuff is cyclical. It keeps coming back, and each time it comes back is shifted up another level. So I see this more as a thing which is spiraling upward and building each time, even though it can sometimes feel that we're revisiting things as well. So with that, and thank you to everyone involved in the organisation, with Cecilia and Lars and David and Christine and others. So big thank you to everyone. And I hope people have found this has been useful, and have everyone had found at least one thing to take away from this.